Yeah, I don't think the word clipped or sorry, pinned back is very helpful in terms of ear correction. I know everyone uses it and says that ears are pinned back when you're describing a prominent ear correction, but they're not pinned back. What the essence of the surgery is reshaping the cartilage. So the cartilage is reshaped somehow, and yes, there are different ways the cartilage is reshaped, but you have to sort of restructure the shape of the cartilage. You don't kind of just pin the ear to the side of your head or pin it back, and you know, you don't just sort of like stitch it back. So it's actually quite a difficult, quite a nuanced operation that I actually don't do anymore. I used to do, well, we all did loads of them. When you're training, you do loads of them, but I haven't done it in so long that I've said, look, I don't you know, I don't really want to do it because the other guys are doing it. So so I don't actually do it. It's actually not easy getting it right. You know, it's quite subtle, the shape of the ear, and it's quite difficult to do. And we do it through an incision posteriorly because you don't want to have an incision that you can see. So you want to do it with an incision on the back of the ear. And broadly speaking, there's two ways to do it. One is by scoring the cartilage, which you make a full thickness cut in the cartilage. So then you can get to the front of the cartilage, you deglove the ear, get to the front of the cartilage and score the cartilage so that the cartilage naturally bends back, and then you put some stitches in the skin. And so it's the scoring of the cartilage which has caused that reshaping. And the problem with that is it's got risk of complications because you're degloving the ear. It's quite traumatic what you do to the ear. You sort of take all the skin off the front of the cartilage, and then you have a big bulky dressing for that skin to stick down again. And if you get any problems like hematoma or anything like that, you can have problems with the vascularity. So it can have complications. And so the other way of doing it is by using sutures. So using long-term sutures, usually permanent sutures, you know, 2 or 3 sutures in the back of the ear just to bring it back and to reset it, so that you're reconstituting the antihelical fold, which is this fold here. So often people with a coronary ear don't have that fold, so you reconstitute that fold. Also, there can be a problem with the concha being too big, which is this kind of bowl here. So you can reduce the concha, and you can also bring the ear back closer to the mastoid, that bone sort of behind the ear. So reset the whole ear back, as well as reshaping the cartilage, and that can be done with permanent sutures, or it can be done with the sort of degloving technique where you recontour the cartilage. And then either way, the skin is closed with stitches, but it's actually not the skin closure that is doing the job. You kind of done the job inside. You're not really relying on the skin closure to bring the ears back. And it's stitches. We tend not to use clips. Oh, in terms of clips, you might be talking about the, what's it called, Ear Buddy? Oh God, we did loads on it. Ear Buddy doesn't sound right. What's it called? Maybe it's called. Anyway, there was a clip that you could put on the ear. Oh God, did loads of videos on it, and Mark Lloyd did a Q&A. Anyway, there was a clip that you could put on the ear, which was a much simpler operation, just a clip to reconstitute that antihelical fold. It's a much simpler operation, and that did seem to gain some traction, but I think that company no longer exists, and I think they no longer, it'll come to me, what was it called? Ear Buddy sounds wrong. Anyway, it's no longer available, the clip, so you can't do the clip anymore.